two primary reasons that your low carb diet is not helping you get pregnant. First reason is because carbs are not the issue. The issue is with how your body is able to process and utilize carbs as energy. So when we are just removing carbs or eating low carb, then we are just taking away nutrients. Still does not fix the fact that our body is not able to get the energy out of carbs the way that it needs to function the way that it's supposed to. So instead, if we focus on fixing that process, it's called our metabolic health, how our body is able to utilize carbs and just nutrients as a whole as energy, that is therefore going to improve our health as a whole, but also insulin resistance at a root level to improve your metabolic health and how your body can use carbs as energy and start fixing the issue instead of just eating low carb. Second thing is eating low carb is given as a recommendation because insulin resistance is typically a primary root cause for a lot of PCOS, which that is true and a factor that needs to be taken into consideration. We just talked about that. But for a lot of people, there also is a liver function, gut health, gut pathogen, gut infection, underlying sources of inflammation, thyroid function thing, probably a combination of all of these things going on under the surface, also contributing to their PCOS. Low carb does not fix those things or even address those things at all. So that's why you're eating low carb. It's not addressing these things, and these are things that are just as much of a factor in your PCOS as the insulin resistance. So these are two primary things I do differently within my programs. One, we're actually fixing your insulin resistance instead of telling you to eat low carb. This actually requires you to eat more carbs typically, but then we're also taking into consideration other root causes contributing to your PCOS. And those two things make the world of a difference in how my clients are able to get pregnant naturally with PCOS without having to go low carb.